this may all be old, it may not be, but I'm going to talk a little bit about making Olecranons just a little bit more fun. So here's my disclaimer, right? So I am not a wizard. There are wizards in this room. We've seen some of them operate. We've seen some of them dissect. I'm not one of those. This is not a cat in the hat talk, which I call when people are like, look what I can do, look what I can do, look at where I can put that screw. So this is none of those things, right? This is something that's taking a thing that we do a lot of, and for me, it makes it a little more fun. That's all, right? So I'm 100% sure that the way you currently fix these is fine. I'm not telling you your way is wrong. I'm not telling you my way is the only way to do it. I'm not saying it's better, but it is fun. And so I'm going to plant that seed. So I'm going to tell you these things I struggle with. You're going to be like, I don't struggle with that at all. That's not a problem for me. It probably isn't. Your way is fine. I will stipulate that. We're going to move on. Yeah, well, I know the flavor of this room. All right. So I find Olecranons futzy. I'm going to confess. Even a simple transverse Olecranon, I'm not like, let the resident do that, go into another room. I find them a little bit tricky. Plates are thick, they bother people. We've all seen that x-ray, it's not my x-ray. Tension banding is hard. The K-wires can either back out or they can catch nerves. These are bad enough that we've just given up on them in old people, right? Now we're saying, if you're over 80 or whatever, low demand, displaced Olecranon, don't even fix it at all because the complication rate is too high. It's not worth it. As an aside, I don't really know what that means, low demand. Like, if anybody has any feedback on how to ask an 80-year-old lady if she's old demand in the office, like what words do you use? Because I'm never like, hey, you don't need your elbow, right? You're cool with that? Like, I don't know how to ask people that in the room to get that. It really just sounds like if and my partner Jill calls it smelling them. You look at them, you're like, I don't want to operate on you.
They can't